Good day, everyone, the nurses and friends. This is Alfred again. This is our NCLEX RN test taking strategies. This is strategies 8 and 9. And going forward, number 8, always assume that the NCLEX, assume with the NCLEX that hospital has unlimited staff, equipment, and resources. As we all know, nurses are in great demand because of shortage. So we should not, with NCLEX, it's always the ideal. Whether you're in the Philippines or India or wherever you are in the world, there might be some short staff, there's no equipment available, or the resources are not there. But we must remember that there is unlimited resources with the NCLEX test questions when you answer it, because the thing is the ideal situation. It's not realistic, it's the ideal situation. Moving forward, let's do number 9. Restraints are always the last option and are almost always the wrong answer. As we all know, restraints are only applied when there's a possibility of self-harm or suicide precautions, and even that, it has to be ordered by the doctor, as well as it should be done carefully, right? Now, there are 5 types of restraints: chemical, mechanical, physical, and environmental, as well as seclusion. Moving forward, this will be our multiple choice for the day. An older resident who is disoriented or confused likes to wander the halls of his long-term care facility. Which action should be most appropriate for the nurse to use as an alternate restraint? Option 1, sitting him in a geriatric chair or geri chair near the nurse's station. Now, this is this might be construed as also a restraint, because the patient cannot just go out of the room by himself. The nurses have the eyes looking at him. So this is kind of a type of restraints as well. Option 2, using the sheets to secure him snugly in his bed. Now, this is obviously a pure sign of restraints. While other types of restraints, aside from this one, would be the vests, the strap belts, the limb ties, the wheelchair bars and brakes, and the geri chair actually is also a type of restraint, as well as bedside rails. Option 3 is also a restraint, because keeping the bed in a high position, that means the patient would likely be afraid to get out of bed, because he might fall. He might fall, and he will fall if he will try to get off the bed. So that is a kind of restraint. While the last option would be the correct answer, since it's the least invasive restraint. No, it's like identifying his door with his face picture and a balloon, a color of a balloon, where the patient chooses. That way, he will be reminded of where to go if he wants to go back to his room. It is kind of a restraint, but an alternate one, a very least invasive restraint. So the number 4 would be the perfect answer. Okay, have a nice day. Bye-bye.